जी हेलो सुंदर भैया नमस्ते and welcome all family member in this our weekly follow up meeting.
Namaste.
Namaste भैया, how are you?
I'm fine. How are you?
I'm actually also fine जी. So what we are going to discuss today भैया?
Actually, before last week, I promised about Pranayama and Mudras, but
Yes.
right now I'm in the village where I don't have access to computer and all. I just joined through mobile. So today I'll take one more important topic, autoimmune disorders. But if there are any questions before that, we will take the questions and we'll.
Yes, certainly. So dear family members, dear participants, dear co-explorer, if you have any question regarding the holistic health, we have our source person, our guide mentor Sundaraj भैया with us. You can unmute yourself and ask. जी.
Good morning, doctor.
Good morning.
I'm JVS Gupta here. Sir, last time I put in the chart this oil massaging the foot, the entire body and all that. I mean, we could understand whatever you told, but under the feet, that means foot, barefoot. What are the advantages? I mean, how do you suggest it for people?
Yeah. See, in Ayurveda, applying oil to the body is considered to be the most important part in Swasthavata or the health regime. So, if someone is very busy and that particular day he is unable to apply oil to the whole body, in fact, it is recommended that every day we need to apply oil to the whole body and take hot water bath as much as possible. And that will increase the circulation, strengthen the muscles, stimulate the nerves, applying oil to the whole body. If it is not possible in a given particular day, Ayurveda recommends Siras Shravana Padeshu Tam Viseshena Shilayet. On your head, on your ears, and on your soles, you need to apply oil at least on these three places: head, ears, and soles on your feet. So, why is it very important? Why is it very important that we will try to understand? Our feet are having so many vital points which directly connect to so many organs of our body. There are so many ancient procedures like acupuncture and acupressure where they press some pressure points on the feet to stimulate various organs of the body, to strengthen various organs of the body, to remove the blocks in the energy channels of various parts of the body, just by stimulating some important vital points on the feet, on the soles. But we need not do all those things. We need not learn, even if we don't know all those things also. Just by simply applying oil to the feet, both the soles, and gently rubbing roundly around all the points without putting a lot of pressure on the feet, we will be able to stimulate so many organs, and not just stimulating. In fact, we can make them relax. So many parts of the body, just by applying oil on the soles, they get relaxed. And people who don't get proper sleep in the night time, just by applying oil on the soles, will stimulate the sleep centers and relax the whole body and mind, and also they'll get nice sleep. So that is one advantage of applying oil to the soles. Another advantage is, just by applying the oil to the soles, the vata, which is aggravated. Vata is the humor which will control the entire the movements of the body are being controlled by this vata. So that will get pacified, and the body will get energized, relaxed, both simultaneously. So if every day night before sleep, one can apply oil both feet. And in the morning time also, if you don't have time to apply oil to the entire body, apply to the feet, apply to your ears, apply to your head. So that will be very beneficial.
Which oil you suggest, doctor?
See, when you say oil, the by default oil is ginger oil or neem oil. So that is the best oil. If
Okay.
you want to apply coconut oil, okay. Will apply mustard oil, that is also okay. Generally, if the body is having a lot of heat inside, then you can apply coconut oil to reduce the heat. If the body is cold, feet are cold, extremities are cold, then you can apply mustard oil to increase the heat.
Okay.
And you don't want to increase the heat or reduce the heat, then you can use simple gingerly oil. That will keep them in balance, keep body in balance.
Okay, thank you, doctor. I got it.
Bhaiya, namaste. Can I add?
Welcome.
Yes, Bhaiya.
Sure, madam. Please.
When we are stimulating this with the oil bowls, so you can do it with that bowl, bronze bowl. Yes.
Yeah, definitely.
With the bronze bowl.
You can use the
हिंदी में बोलूं क्या? कंस की वाटी कटोरी लेके करते ना पैरों के तलुओं को, कंस की ब्रॉन्ज कटोरी लेके वो उसको ऑयल लगा के ही सोल में ये करते हैं ना, रब करते हैं, तो उससे इफेक्ट होता है.
Yes, that is another nice way of stimulating the feet, and it is also very effective. It presses the entire feet uniformly. So if we have difficulty in pressing the points or applying pressure, you can use this bowl and use it to put the pressure on your sole. Yes, that is fine. That is a nice addition, Rubiji.
Thank you, Bhaiya.
Yeah. Any other question we have? So unfortunately, today I'm in the village where very weak, and I hope my voice is clear.
As doctor, it is in between the disturbance is there, but we are able to understand what you're saying.
Okay.
There is slight disturbance, but it's okay. We can able to. It's audible.
Okay. Priyaji. So today I will. Before last week, I actually wanted to show you the pranayama and mudras which you can teach students, which is a very important topic. But this week, because of this low signal, I will not be able to switch on my video. That's why I don't even have my internet. So, but not waste the time. I'll go into an important topic, which is about autoimmune disorders. Nowadays, you might have heard about certain autoimmune disorders like psoriasis, rheumatoid arthritis, ankylosing spondylitis, Sjogren syndrome, vitiligo, and systemic lupus, type 1 diabetes, Crohn's disease, ulcerative colitis, and suddenly some people become blind without any reason. Some people become deaf without any reason. There are 100 plus autoimmune disorders. And it is very important for us to understand this particular concept where our own body is getting attacked by our own immune cells. So our own body is producing antibodies which are attacking our own tissues, and this is leading to deterioration of the particular part of the body, and sometimes destruction of that particular tissue, organ, etc. So it's very strange. Our own immune system, which is designed in such a way that it will always help us fight with the bacteria, fight with the virus, fight with the fungus, fight with the microorganisms, and keep us healthy, keep us safe. Those immune cells, instead of fighting with the external microorganisms, they are fighting with our own cells, with our own tissues, with our own organs, and damaging our own body. And these diseases are nowadays very, very common. I can't just tell you how much dangerous these diseases are turning out to be. And modern system of medicine right now is not in position to handle this menace called autoimmunity. Luckily, we have wonderful solution to autoimmune disorders group of our diseases. There are 100 plus diseases. Just like I've told you, each part of the body can get affected, attacked by our own immune system, and once it gets attacked, it produces certain disease. So in that way, there are 100 plus diseases where our own immunity is attacking our own body. So like we have these lymphocytes, T cells, B cells, natural killer cells, neutrophils, monocytes, macrophages. All these cells various functions and make us healthy, keep us safe. And not just these cells, our skin is also a beautiful, wonderful protection, and it stops this in our own body and keep our safe. And there is an intestinal epithelial area, gut wall of the intestines, where it is covered by bacteria, helpful bacteria, gut flora, which always sit there and will not allow harmful bacteria to pass to the. So all these are working in a beautiful harmony, and they're all keeping us safe. But our own immune system is attacking us. Like there is this border between, and our border security force is always guarding us, is helping us stay safe. And suppose some of these are, they are attacking our own Indians. That is called autoimmunity. Our own cells are attacking our own body, and we do not know which particular army officer or soldier is our own Indians. And if we keep entire army in jail or stop them functioning, then our border becomes weak and anyone can enter our body. That is the problem with autoimmunity. The only solution in modern system of medicine is to give some suppressants, suppress the immune system our own body. But when you suppress the entire immune system gets suppressed, and that will result in weakened immunity and infections from outside. So this is a very critical condition where stimulate the immunity, you can't suppress the immunity. Either way, you are having problem. If you still attack your own body with more strength, if you suppress it, it becomes weak and you are prone to infections. This is the problem. So when this happens, when our own immune cells attack our own body, three things happen. what happens, one is damage or destruction to our own tissues. Our own cells and tissues, they get destroyed by our own immune cells. Then altered organ growth. Our own organs, they don't grow properly. Altered organ function. Our own organs, they don't function properly. So this happens anywhere, it can happen. Our immune system can attack our own brain and it can cause multiple sclerosis, Guillain-Barré syndrome, autism, like those diseases. If it attacks our own thyroid gland, it can cause thyroiditis, Hashimoto's disease, Graves' disease. When it attacks our own bones, it can cause rheumatoid arthritis, ankylosing spondylitis, polymyalgia rheumatica. And immune system, when it attacks muscles, rheumatoid arthritis, ankylosing spondylitis, and polymyalgia rheumatica, similar things, whether it is bone or muscle, when they get attacked, all these diseases will be visible. If the immune system is attacking our own skin, we might get psoriasis, vitiligo, eczema, scleroderma. If the immune system attacks our lungs, we may get fibromyalgia, vaginous granulomatosis. When it attacks our own nerves, peripheral neuropathy, diabetic neuropathy. When it attacks our intestines, GI tract, gastrointestinal tract, celiac disease, Crohn's disease, ulcerative colitis, diabetes, type 1 diabetes, which we see in small kids, type 1 diabetes. When the immune system attacks our own blood, we may get leukemia, lupus erythematosus, hemolytic dysglycemia, so many diseases. And nowadays, we are getting so many diseases and we are treating day in and day out, we are treating so many autoimmune disorders. As I'm speaking this thing in my hospital, in my village, so many, more than 50% of our patients who got admitted in our hospital are affected by autoimmune disorders, used so many steroids without any help, and then they came to Ayurveda way of therapy. So I have treated diseases like ankylosing spondylitis, rheumatoid arthritis, psoriasis, vasculitis, systemic lupus erythematosus, multiple sclerosis, type 1 diabetes, vitiligo, endometriosis, Crohn's disease, ulcerative colitis, Sjogren's syndrome, sudden hearing loss. All these diseases I have treated myself, in which I will just give a simple understanding of what these diseases are. Ankylosing spondylitis, like our backbone is not a single bone. There are around 33 separate bones, which are like beads in a chain, which enables us to be flexible, bend forward, bend sideways, bend backward. But if these beads fuse with each other because of the attack happening from our immune system, these bones fuse and the whole entire backbone becomes a single bone, like bamboo spine. Then you will not be able to sit, you will not be able to move, you will not be able to stretch, with a lot of severe pain will happen. This is called ankylosing spondylitis. Rheumatoid arthritis is another disease where there will be swollen and inflamed synovial membrane, the cartilage which is present in between bones gets affected, and the synovial membrane on the bones, they get inflamed, they become swollen, they become red, they become full of so many antibodies attacking them. And this joint tissue is being attacked continuously by our own body. So the joints, they swell up. You will see people with swollen joints, not just the bigger joints like knee joint and or shoulder joint, but small joints in the fingers of the feet or hands, they become swollen. Sometimes deformities set in, permanent changes will happen. All these are happening because our joint is getting attacked by our own body. So just a moment. So This is called rheumatoid arthritis, which is commonly seen in many people, not just older people, even younger people we are seeing. Then there is psoriasis. Psoriasis is a disease where skin division becomes very fast because of attack of the immune system on the skin. Normally, skin cells divide. One cell becomes two cells become four cells. Here, one cell becomes 10 cells, 10 cells become 100 cells, and they form a reddish patches on the body, and the skin falls on the ground, and it feels like anything, severe itching, and lot of burning sensation. All these things happen. So that is called psoriasis. Then we have vasculitis, where our blood vessels get affected. Blood vessels get attacked by our own immune system. Arteries and veins in our hands, in our legs, they get affected, and they cause lots of red patches on the skin, and blood clots happen, and blood leaks through them. And then we have systemic lupus erythematosus, where multiple organs get affected with this particular attack of immune system. There'll be joint aches, arthritis, swollen joints, headache, fatigue, hair loss, butterfly rashes on the face, on the cheeks. In the mouth, there'll be ulcers in the mouth and nose. In the lungs, there'll be hemorrhage. Blood will be leaking through the vessels. Sometimes pneumonia inside the lungs, blood in urine, and in our heart vessels, atherosclerosis, endocarditis, cardiac inflammation, and hemoglobin gets reduced, anemia, hypertension. All these things happen in systemic lupus erythematosus. So this is also happening because multiple organs are being attacked by our own immune system. If the immune system is attacking our own nervous system, particularly brain, so immune system eats away the protective covering of our nerves. Nerves will have a insulation sheath, myelin sheath, and it gets eaten away by our own immune system. It is called MS, or multiple sclerosis. So nerve damage happens, and sometimes the communication between brain and body gets disrupted. So it causes so many problems, like suddenly loss of vision, pain, fatigue, impaired coordination. So many things happen. Similarly, type 1 diabetes. Small kids, they get affected because the pancreatic beta cells get destroyed because of this immune cells, and there will be no insulin production or very less insulin production. So children will get blurry vision, frequent urination, frequent hunger, frequent thirst, and children from a very young age, from age of 3, age of 4, they insulin injections twice a day, even 4 times a day. Similarly, when the skin gets attacked by immune system, particularly the part which produces a pigment called melanin, then the skin becomes white. White patches happen on the skin. It is called vitiligo. All these are autoimmune disorders. There is Crohn's disease and ulcerative colitis, where intestines get attacked by immune system, and so many ulcers get formed on the intestines inside our body. There is this Sjogren syndrome, where the parts which are dry, which are fluid, like dry eyes and mouth and all the mucous membranes, they get dry. Eyes become dry, mouth becomes dry, and skin becomes dry, stomach becomes upset, vagina, in ladies, vagina becomes dry. Memory loss is seen, speech difficulties are seen, heartburn, respiratory conditions, pain and arthritis, liver problems, numbness in the extremities. All these are seen in Sjogren's syndrome. And sometimes sudden hearing loss, sudden vision loss happens in certain diseases. All these things are happening just because our own immune system is attacking our own body. We have various tests like ANA, C reactive proteins, ESR, serum ferritin, HLA-B27, RA factor, autoantibody tests, so many tests which will tell us that our own immune system is attacking our own body. So in allopathy, generally they give corticosteroids like prednisolone and other immunosuppressants like azathioprine, cyclophosphamide, mycophenolate. So all these medicines will just suppress the immune system. And every 2-3 months, we have to get them tested to see that these steroids are not damaging their own body. Renal function test, kidney function test, liver function test, sugar test. All these tests we do not to see whether the disease got cured or not. It is only to see that the steroids which you are giving to suppress the symptoms are not causing any disease, dangerous diseases. So then how can we protect ourselves from this particular autoimmunity? How can we protect our loved ones from autoimmunity? How can we prevent autoimmunity if someone is experiencing similar rheumatoid arthritis or psoriasis or vitiligo in our family? How can we prevent other members? And how can we help the people who already have these autoimmune disorders? This we will discuss today. So management in Ayurveda includes correcting the ahara, correcting the food, correcting the lifestyle, correcting the vihara, and treating both body and mind. So most of the problems are somatic in nature. Here, not just the body, even the mind is disturbed, and treatment is needed for both the body and mind. So normally, why do we get this autoimmunity? What is the real cause behind this autoimmunity? Why do people get such strange behaving immune system? And we go deeper into the etiology of all these diseases. One thing common is bad lifestyle and bad food and bad disturbed mind. Nowadays people are not eating in time, not sleeping in time, not getting up in time, not doing physical activity, not exposing their body to sunlight, exposing their body to a lot of pollution, and mind is full of stress, irritation, anger, fear, mental stress, hormonal imbalances, unhealthy food, smoking, alcohol, so many reasons. And ultimately, all these reasons will result in accumulation of free radicals or toxins, endotoxins produced in our own body. Free because free radicals circulate all over the body, and radicals because they disturb all the chemical reactions which are happening inside our body. So these free radicals get accumulated when we have a bad lifestyle, bad food. And these free radicals, they disturb the immune cells, disturb the immunity. And the immune cells, which are supposed to be thinking cells, they actually know, they can differentiate between the good bacteria and bad bacteria. Such intelligent cells get confused and they will not be able to differentiate between bad bacteria and our own cells. They think our own cells are enemies and they attack our own cells. So in Ayurveda, to correct this condition, first we remove these causative factors called free radicals from each and every cell of the body. So we do Panchakarma therapy where we do some detoxification therapies or Manakarma, which will help in removing toxins from each and every cell of the body. Then we have some special therapies called Vastikarma, Nasyakarma, Raktamokshana, which will help in correcting the disturbed immune system, modifying the immune system in that it will not attack our own body and it will stop working against our own body and start working in harmony with our own body. So there are some other procedures like Shirodhara, Shiropichu, which will relax the mind, reduce the stress and keep the mind relaxed. And other therapies like Sarvangara, Kashayadhara, Dhanyamladhara, Kutachapatra, Agnikarma to relieve specific symptoms of autoimmune disorders. Of course, there are some special procedures like Kevala Kshirapana. So after completing these detoxification therapies, to correct and regenerate the body, each and every cell's regeneration can be stimulated by a special therapy called Kevala Kshirapana. 48 days we give only milk, nothing else as food. Breakfast milk, lunch milk, dinner milk, and snack milk, everything is milk, nothing else. Only milk. And we medicine. So for some people who follow the vegan lifestyle, who do not, it sounds very strange, but this particular therapy is around 5,000-year-old therapy, very effective in regenerating each and every cell of the body. We have treated many autoimmune disorders with this special therapy called Kevala. There is another therapy called Kevala Takrapana, where 21 days we give only buttermilk and give some special medicines during this particular regimen. Particularly some medicines we use in Vardhamana Kalprayoga. Slowly we increase the dose day by day, the medicine dose will increase and go to the peak, and then we slowly decrease the dose. And the whole treatment time we give either milk or buttermilk. Of course, we only use Indian cow, healthy Indian cow's milk, and for this particular procedure. These are all different procedures. There are so many beautiful immunomodulatory drugs like Guduchi, Shatavari, Ashwagandha, Estimadu, Amlaki, Shadguna Sinduram, Abragabasmam, Swarnamakshik Basmam. All these medicines are immunomodulatory in nature, help in restoring the balance. They will help in bringing the wisdom back to the immune cells so that they will differentiate between body cells and enemy microorganisms, and they will work at it. So there are so many medicines. This is one where direct involvement of Ayurveda doctor is needed. But this is not enough. Autoimmune disorders mostly are psychosomatic in nature. So treating the body is one part, but treating the mind is another important part. So we teach pranayama, make them do pranayama, and also meditation, dhyana. Will make them practice silence. Silence is something which is, I'll give you a small idea of how we make them practice silence. Meditation is something where we focus our mind on one particular thing. Whether you focus on your breath or on your favorite god or any mantra or a particular point on the wall or a candle, any where your mind is focused completely without getting deviated. This is just practice. But practical application, real application of meditation is always 24 hours. Whether you are listening to this session, whether you are polishing your shoes or your dishes or whatever you're doing, if you're doing it with razor sharp focus, undivided attention, that you're doing meditation. If a cobbler polishes the shoe like no one else does in the entire world, is the best cobbler, whole entire focus is on polishing the shoes. That polishing the shoes itself is meditation. While you're brushing your teeth, you're brushing in so nicely without deviating your mind, without thinking anything else. You're just focusing on brushing your teeth. That is also meditation. While you're bathing, you're just focusing what's happening while you're bathing. When the hot water is falling on your body's circulation increasing, and you can feel the movement of blood inside your body. Just observe what's happening on your body. Focus on your body. That is also meditation. So this is one part. But then we have a different kind of practice called silence, where we try to achieve a thoughtless state. Generally, for our patients, we teach them a simple procedure of practicing silence. Normally, when you observe what's happening inside you, you can see that there are continuous thoughts, a stream of thoughts coming continuously. Researchers say that there are around 50,000 to 60,000 thoughts experienced by each and every human being on an average. Continuous thoughts. And most often they are linked to each other. One thought comes and then we link another thought to another thought. then another link, and there is no gap at all. These thoughts come in succession, continuously they come. Even if you try to take your mind away from these thoughts, again they come back. So how do we achieve this thoughtless state? When you say silence, it's not just keeping silence and not speaking with other person. If you're reading a book, you're in conversation with the author, listening to audio, or you're not just doing anything, closing your eyes, still the internal chatter happens. There is no silence. So the silence will happen only when there are no thoughts. How do we do that? I explain this. I make my patients practice this silence in this way. So I ask them to imagine themselves standing at the mental toll gate. To check their thoughts. Check what to classify their thoughts. How to classify? There are 50,000 to 60,000 thoughts. How can we classify? If you observe closely, even there are 50,000 to 60,000 thoughts, you can classify them into two broad groups. One set of thoughts which will make you happy, another set of thoughts which will make you unhappy. And then if you further classify, happy thoughts which happened in the past, thoughts about the events which happened in the past, or happy thoughts about the events which might happen in the future. Similarly, sad thoughts about the events which happened in the past, sad thoughts about the events which might happen in the future. So only happy thoughts, past thoughts, and future thoughts. These are the broad. This is a broad classification, but there are some miscellaneous thoughts. We can think about the discomfort in our body or some nearby sound or whatever is happening. These are all miscellaneous thoughts, but majority of the thoughts are about these things. So now we need to stand at the mental toll gate, and when each thought is passing, we need to judge this. We need to look at this thought and classify whether this thought is happy thought or sad thought, past thought or future thought. That's all. And let it go. Let it go with detachment. This detachment is very important. When you get attached to that particular thought, like you get a thought that I have a small pain in the neck. This thought appears. This is a very small thought. Then a next thought appears. This pain is persisting, and sometimes this neck pain is radiating to my hand. Doctor asked me to go and get an MRI. And he told me that if there is any disc degeneration, I should get operated. Some surgery needs to be done. And my friends told me that his operation is very complicated, and some friend got entire both legs and hands paralyzed after the surgery. So it is very complicated. And if my MRI turns out to be a degenerated disc, and if I get an operation, and if there is a complication in the operation and I get paralyzed for life, or if I lose my life, what happens to me? What happens to my kids? What happens to my wife? A small thought like some discomfort in the neck led to death and future of our family. There is a chain of thoughts happening continuously because we got attached to these thoughts. But when you practice detachment with these thoughts, like when you watch Kaun Banega Crorepati, someone got a prize money of 10 crores. Will you think about, how will they give that money? Will they transfer it online or give them cash or check or DD? Will they cut the TDS? Who will cut the TDS? What about the tax? What about the investment? Will he invest in the real estate or share market or mutual funds, or put it in the bank, or will he lend the money to someone else? Who will be the nominee? Where will we be putting the money? All these things we will not think about the other person because it is not our life. We are least bothered about what he will do with his 10 crores. But if it is our own life, even 1,000 rupees also will think 100 times. Or you are watching a movie and someone died in the movie. Will you think about, he died, what happens to his wife? She's young, will she marry again? What happens to his kids? What happens to their studies? What happens to the future? What about their financial situation? Where is the money? Where are the documents? Is there any insurance? All these things we will not think because it is not our own life. It is not even real life. It is a movie. But when it comes to our own life, the smallest of the smallest problems also causes a lot of disturbance, turbulence. So let us practice detachment. And when you are standing at the mental toll gate, trying to classify these thoughts, we will also do this with detachment. We will not experience sadness or happiness while we are classifying these thoughts. We will practice detachment. We'll just look at the thought as it is. Is this a happy thought or sad thought? Future thought or past thought? Once it is classified, let it go. Then next. Toll gate vehicles come, they get checked and they'll leave like that. Each thought comes, we'll check the thought and we'll let it leave. Another thought comes, check the thought and let it leave. Another thought comes, check the thought and let it leave. When you're practicing like this with detachment, with focus, there comes a time when there will be a gap between one thought is left, has already left, and the next thought has not yet come. And that place where there is no thought is silence, my dear friends. So this particular point where there is no thought, absolute thoughtless state, that is the state where we need to strive to stay for a longer duration. With our own Sankalpa Shakti, with our determination, we will try to spend more and more time in a gap between two thoughts. Initially, when you sit in silence for 10 minutes and if you experience actual silence for 20 seconds, that is great. And with practice, if you can do it for 2 minutes, that is wonderful. So, but once you experience this silence, thoughtless state, that will change, that will bring changes even at the level of the DNA. It will bring wonderful changes in each and every cell of the body. Not just the mind, even the body gets healed. And diseases like autoimmune disorders, they get corrected. So we request our patients to practice silence. We also teach them how to practice non-judgment. Non-judgment is something where we will, normally we always analyze things. Why this is happening? Why this is happening now? Why this is happening to me? Why this is happening to only me? Why me? Why is that person behaving like that with me? Is he rude or am I wrong? Did I do something to piss him off? What did I eat yesterday which is causing so much stomach pain or fever now? So continuously we analyze, we try to find answers, we analyze and then we pass a judgment. That day I spoke like this, that is the reason why he's behaving like this. That day I ate that particular thing, that is the reason why I'm getting this thing. So continuously this happens in our mind, in our brain. It's analysis and judgment. And this happens continuously and drains our energy like anything. A laborer who works from morning till evening in hot sun, he spends a lot of energy. But more than him, without moving a single finger, sitting in a chair in AC, we spend more energy just by analyzing and passing judgments. So we request our patients to practice non-judgment. Non-judgment is something we need to practice continuously, but initially we ask them to practice for 1 hour. We'll tell them, suppose if we have exams tomorrow, today I'll keep everything aside and we'll focus only on studies. I'll say tomorrow after exams, I will worry about other things. Similarly, this next 1 hour, I will not analyze anything. I will not think about anything. I will not judge anything. I will do whatever I am supposed to do, but I will not overanalyze and overthink and overjudge people, overjudge events, overjudge myself. I will not judge anything, anyone, any event. So like that, we ask them to practice, and some days we ask them to practice for 3 hours or complete day in 1 week, 1 day completely for non-judgment like that. And we also ask them to prioritize life. Prioritizing life is very important because health and relationships are very important thing, but normally people prioritize their career higher, and that generally causes so many problems and stress and all those things. So to treat these autoimmune disorders which are psychosomatic in nature, we ask them to bring peace in their mind. We also teach them visualizations, affirmations, which we will speak later. So all these things will help in changing the nature of the immune cells, which will affect which will actually modify the immune cells in such a way that they will not attack our own body. In fact, they help our own body. Food also, we ask them to avoid stale food, fried food, chilled food, spicy food, reheated food, pickles, bakery items, non-vegetarian food, all these things which might cause, trigger the accumulation of free radicals and disturb the immune system. We ask them to eat only sattvic food, freshly cooked food, fresh fruits, fresh vegetables, milk, ghee, usage of gingerly oil, different grains, different vegetables, mainly pesticide-free food, organic food. In our own hospital, we provide this organic food. We conduct yoga sessions every day, morning 5:30 to 7, evening 5:30 to 7, for all the inpatients. And then we have a full-fledged yoga teacher who sits with each and every patient, and we have a tracker, self-tracker, where they have to tick and write about what they did, the pranayama, how many minutes, meditation, how many minutes, silence practice, how many minutes, non-judgment, how many minutes, how many minutes of visualization, how much time of affirmation, all these things. So whether, if they do, they'll tick. If they don't do, they'll into. They will see we'll track the progress also. We'll correct their lifestyle. We give them timely food, timely sleep, make them up early in the morning. Every day they'll get up 4:30 in the morning. Every patient, even if they are weak, we'll make them do physical activity, and we'll make them prioritize health and family above their career. So we are seeing wonderful results in autoimmune disorders in our hospital, particularly in patients who follow this good lifestyle, eat good food, and undergo these cleansing therapies and metabolism correction therapies, immunomodifying therapies, immunomodulatory therapies. They're actually experiencing remarkable, dramatic shift in their immunity, and very fastly, within very few days, they're stopping all the steroids which they were using from so many years, and then even their deformities are getting corrected. And I'm so happy to inform you that so many doctors, allopathic doctors, homeopathic doctors, they are getting admitted and getting treated, and they're appreciating this unique combination of yoga and Ayurveda and correction of lifestyle. So my advice to all of you is, instead of searching for a hospital which can treat your problem after it comes, after it appears, we can start doing all these things right now. Right now, we can start eating fast, eating in the right time, sleeping in the right time, getting up in the right time, doing physical activity, keeping our mind relaxed, and prioritizing our life, regularly practicing pranayama, meditation, silence, non-judgment, visualizations, affirmations. All these things will keep us healthy and avoid not just autoimmune disorders, but so many diseases can be avoided. So many diseases can be, if you already have some difficulty, some problem, some disease, using medicine from some particular problem, I can assure you that you can live a disease-free life. You can live a medicine-free life, even for diseases like high blood pressure, sugar. Even if you're using insulin, you can stop using insulin just by correcting your lifestyle. And few days of regular practice of yoga followed by regular practice of yoga will help and will create dramatic, miraculous improvements in your state. And those people who are already healthy, they can go to the next level. They can have the hidden potential, and they can do higher things, greater things. They can do deeper work, and they can actually truly bring their potential and achieve the life's purpose. So this is what I have to share today. So if you have any questions regarding autoimmune disorders like psoriasis, rheumatoid arthritis, vitiligo, ankylosing spondylitis, or any other autoimmune disorder like systemic lupus erythematosus, Sjogren's syndrome, Crohn's disease, you can ask me questions. Or if you have any questions about immunity or anything else, you can just switch on your mic and ask a question, or you can send a message in the chat window.
Good evening, sir. Can you hear my voice?
Yes, yes, Arunachalamji.
Yes, I am Dr. Arunachalam. I am a chemist basically.
Yes,
In generally, in the hot season, we drink in the ice water, but at that time it's very cool in the body. After that, it creates a cold. How to avoid this condition?
yeah. Generally, season body craves for something which will reduce the heat inside the body. So naturally, people think that drinking cold water will do the thing, but it will not. That's why Ayurveda has a specific part of Swastavrata called Ritucharya, which will tell us what to do in what season, different seasons. For example, this is summer season and it is so hot. So to bring down the internal temperature and bring down the excess heat and slow down the metabolism, we need to choose items which have that cooling property, not cooling water. There are so many things like sabja seeds, dhania seeds, and
Lemon juice.
yeah, lemon is also good. There is a wonderful herb called sariva. In South India, we call it as Sugandhi in Andhra Pradesh. Sugandhi in Andhra Pradesh and Nannari in Malayalam, I think. So there are other names also. So this is a root, and the decoction of the root is available as a drink in every store. All you have to do is mix it with little water and drink, and it will reduce the heat like anything. And there are some herbs which will give that cooling effect, not the cold temperature, but cooling effect is needed to reduce the metabolism and slow down the metabolism. And there are some simple yoga procedures like Shitali and Shitali, Shitkari are simple yoga procedures. You have to breathe through your teeth, breathe through your tongue, and that instantly reduces the excess heat inside the body. Of course, there is this pranayam through the Chandranadi. Chandranadi is like left nostril, you just breathe in, breathe out through the left nostril. That also reduces the temperature. You can even check it. You do the pranayam for 10 minutes and check your body temperature. It will come down. So there are so many procedures. And like even as I've told you, applications like coconut oil cools down your body. This sandalwood powder paste you can apply. Coconut oil on the head or ghee on the head. But
No audio.
can be done, particularly during the summer season. It will cause a lot of disturbance in the digestive system, and it will. Yes.
हेलो हेलो
Hello.
हाँ भैया नमस्ते am I audible
Namaste. Yes,
am I audible
yes, you are audible, Ashok ji.
हाँ can you tell regarding asthma whether it is an autoimmune disease or not? First question. Second question is that
Can
you
you
said
repeat again? Not so clear. Can you repeat?
yeah I'm talking regarding asthma. Is asthma is
Asthma.
autoimmune disorder? First question. And the second question is that you said regarding the autoimmune disorder. Like we know that when we do have a imbalance in Vata, Kapha and Pitta, right? So Pitta causes your acidity
Yes.
and cough causes a cough, cold and other things. We know that. So you supposed to Ayurveda supposed to treat in that way that to balance that one or a bath, Pitta and cough. Then they used to treat the disease. So what you say regarding this autoimmune disease that the person is having autoimmune disorder and his immunity is hyperactive or just below active. So in that case, what you say regarding this Vata, Pitta, Kapha, how you relate that one? Is there any documentation is there on that? And how you said that, can you give that example of asthma? Have you treated the asthma patients regarding that? I am interested in that. Thank you.
So asthma directly, the regular bronchial asthma is not an autoimmune disorder, but we have many asthma patients. There are certain conditions where the lungs get attacked by immune system, and when such thing happens, when the lungs, our own lungs, they get attacked by immune system, then also there are certain conditions where fibromyalgia, vaginous granulomatosis, or some other lung diseases happen where there will be breathlessness. But general bronchial asthma is not a it is an allergic reaction. The bronchioles, they get constricted, and the flow of air will get
So my question
reduced.
is that, no sir, hello. So here that
Yes.
bronchial asthma, what you said that some allergy triggers the hypersensitivity and it secretes some much more mucus. So that
Yes.
is the basically the immunity is responding to anything, what is the foreign, some dust particles, sometimes the food, sometimes other things also, and it is so hyperactive. My brother is not having that hyperactive, but I am hyperactive. That means that my immune cells are responsible for that, not my brother. So what that I am asking. So is it not that bronchial asthma is an asthma?
So when it is allergic bronchial asthma, so
Yeah, most of the time asthma, most of the time it will see asthma causes due to this allergy.
yes.
It may be because
So
sometimes cold, sometimes sun, sometimes dust, sometimes food, anything. When someone is sweeping the room, so we having sneezing and just causes asthma. That's it.
yes. So this body is overreacting for this smallest form of change in temperature or smallest form of dust. Something is happening. This over hyper reaction of the immunity. Though we don't call it as an autoimmune disorder, but this is definitely a problem with the immune system. And we have wonderful medicines and treatment procedures for bronchial asthma, where the hyperimmunity gets decreased and the airways become very smooth and open. And then the great example for the solution to this problem is myself. I was a patient of bronchial asthma from my childhood, and I was like a weather indicator. Whenever I get bronchial asthma, then people will understand that tomorrow it will rain, or within 5-6 hours it will be raining, or weather will change. I was like a weather indicator. So whether it is a dust or change in the temperature or whatever it is, I used to suffer with bronchial asthma like anything. But the moment I entered my Ayurveda college for graduation, I consulted one of the very good experienced professors, and they gave me a wonderful medicine to increase strengthen the immunity of my particularly respiratory system. And my professor, my doctor, he told me, use this medicine for 3 months, you will not get bronchial asthma for the next 3 years. And use it for 6 months, at least 10 years, you will not get it. I never had the chance of enjoying, getting wet in the rain or enjoying in cold weather. But once I started using that medicine, I became so strong. My immunity became so strong. And in my entire practice of the past 18 years, I gave the same medicine to so many patients who got cured, got rid of the inhalers and the bronchial asthma medicines. So there is wonderful treatment, particularly for bronchial asthma. And the second question, you were asking the correlation between the doshas, three doshas, and autoimmunity. So what happens in autoimmunity is the best part of three doshas, dosha dhatus, the essence of the entire body, all the 7 dhatus is called ojas in the body. Ojas is the best essence of our body, and this ojas regulates the immune system. And there will be a disturbance in ojas. Ojo kshaya sometimes happen, and ojo vikriti happens. Ojas is the like the sapta dhatus, rasa, rakta, mamsa, medo, asti, majja, shukra, 7 dhatus. These are all different tissues, and the essence of all these tissues is called ojas. And this ojas is the one which strengthens our body and keeps our body safe from diseases. And when there is disturbance in this ojas, then we get diseases, various diseases like amavata. Amavata is compared with rheumatoid arthritis, psoriasis, Kitipa. So all these things are happening because of the vitiation of ojas. And this vitiation of ojas happens because of the ama. Ama is we can say again, we can compare this ama in Ayurveda with free radical accumulation in a modern system. So when this harmful accumulation of these free radicals or doshas, ama, happens inside the body, it vitiates the ojas. And when ojas gets vitiated, then different parts of the body get affected according to the condition of the body. And then we see various complicated diseases like autoimmune disorders. So we can compare ojo vikriti, vitiation of ojas with autoimmunity. So Ayurveda wise, we can say ojo vikriti. And this ojo vikriti, when it happens, it is not just a disturbance in vata or pitta or kapha. It's not just disturbance in the rasa, rakta, mamsa, medo, asti, majja, and shukra dhatu. So it happens entirely. This is the essence, entire essence of the body is ojas. So there the vitiation happens. It is the causative factor for the disturbance in the immunity. So this is according to Ayurveda.
Doctor, can we?
heal the ojas?
Doctor, it is time. Can we?
Sorry?
It is time.
Yeah. We can continue next week, Priyaji.
Yeah, we can continue next week. Actually, many are having questions, I think, because this is one of the common, I think, ailments now. This is mainly, I think, I could see many of my close ones have these issues, and it is mainly due to what you call stress. Even you tell to become no thoughts and all those things. Those people who are having, who cannot control these things are getting these autoimmune disorders, I feel. It is related to that self, like I feel. So we can continue next week, Doctor?
Sure, Priyaji.
Because it's almost time, no?
Yes.
Yes. So thank you.
Thank
you all.
Thank you, Clarity. Thank you, sir. Dr. Sundaraya. Namaste, everybody. Namaste.
Namaste, namaste.
Namaste, everybody.